Thanks so much for the invitation to be here this afternoon. I'm hoping today I can talk to you a little bit about what mindfulness meditation is and how you might begin to integrate it into your own life and potentially into the lives of your patients. So it's a very popular term right now, and I'd kind of like to define it and demystify it, and if we have time, even do a very, very short 2 or 3 minute practice. I actually did grow up in PG County, so it's really nice to be back here. And what was really exciting is that in the audience, when I walked in, I saw my pediatrician. So, yeah, I think he's still here, Dr. Hojati. Yeah, so that was really, really nice. I mean, I saw him when I was a child in elementary school, so so that was a bonus today. So I'm a clinical psychologist at Johns Hopkins, and I work primarily with adults with anxiety and depression, but also with a lot of patients from the hospital who have co-occurring medical issues. And my primary area of interest is in mindfulness. So I'm hoping that today I can sell you a little bit on what this is, and maybe you can start to use it for yourself and for your patients. So I have no financial disclosures. Before we talk about mindfulness, I want to talk a little bit about stress. So most people are familiar with stress. So how many of you have been stressed today? Yeah. So this stress response, and many of you in the medical field can know about this even more in greater detail than I do, but when we're confronted with a stressor, the cave people, our ancestors, had this system in place that was passed down to us. And what this system does is it prepares us to fight or flee or freeze in the face of danger, in the face of something life-threatening. And what happens is the system is activated and blood is pumped to the large muscles of our body, and our breathing increases, and we are ready to face a situation even before we're cognitively assessing that situation. But if you think about the last time you were stressed, most likely it wasn't a life-threatening situation. Okay, most likely you weren't being chased by a saber-toothed tiger. You likely weren't getting into a car accident. It was probably, you were running late, or you got a stressful email, or something that was either psychological or social in nature. That's often, not always, but often the stress we're confronted with. And the problem with turning on the stress response too frequently in situations where it's not supposed to turn on is that it leads to a lot of wear and tear on the body. So chronic stress is associated with a lot of physical and psychological ailments. So hopefully you have ways to work with stress. You might exercise, you might spend time with friends and family. Maybe some of you already do some meditation. You might engage in your church or other religious affiliations. Whatever it is, hopefully you have ways that you deal with stress so that it doesn't become chronic. And today I'm hoping to maybe add one additional tool to your toolbox, which is the mindfulness. So as I mentioned, mindfulness has become a really popular term right now. You see it on the stands in the grocery stores. There's, mindful everything. But I wanted to talk a little bit about what mindfulness is, mindfulness and mindfulness meditation. I'll use those terms interchangeably, and what it isn't. So this is kind of a pretty concise definition of what mindfulness is. So paying attention on purpose in the present moment, non-judgmentally. So we're bringing attention to the present moment, to our experience right now, without judging it as good or bad, but more so just noticing and being curious about our experience. Okay, so almost we're as if we're opening up towards our experience without resisting it, which is kind of new for many of us. The opposite of being mindful is being on autopilot. Okay, this is when we might be mindless, when we're just kind of going through the motions of something. So when are you most likely to be on autopilot? Yeah, driving, at work. So think about that for a moment. Most of the people in this room are not paying attention when they're driving. Okay, this is terrifying. Or some of you are saying at work you're not mindful, and many of you I see in white coats. That is also a little bit terrifying. But this is our society. So we are not in the present moment. And most of the time, even though physically we're here, our minds are elsewhere. And interestingly enough, that can lead to a lot of distress. So when we're not here in this moment, our mind often gravitates towards distress, whatever the situation may be. Not always, but often. And so that creates distress in the present moment, even though there is no actual threat or distress at time. Okay, so the brain can't distinguish between perceived threat and actual threat. So if you tell the brain, oh, this terrible thing is going to happen, it's preparing. It's turning on that fight or flight response, even though in this particular moment there's no danger. And this is how mindfulness can be helpful. You can train the brain to be in the present moment, to notice those thoughts, but not to get sucked into them, okay? Not to get swept up in the current. So when can we practice mindfulness? Essentially, in theory, in every moment. In every moment of every day, you could be mindful. We're not, but it's possible. So there are two kind of components of mindfulness that you can think of. So there's the formal meditation practice where you might envision someone sitting with their eyes closed, bringing attention to their breathing, which I hope we'll have a few minutes to practice. And then informally, any moment of any day, including right now, you can pause and bring attention to this moment right here. So you might be thinking about all the things you have to do or all the things that went wrong. And you have an opportunity to pause for a moment and just come to this moment right here. And that is practicing mindfulness. And both of these components, the formal and informal practices, are important to build that muscle. So just some myths about mindfulness meditation or meditation in general, but I'll specifically be focusing on mindfulness. I have to empty my mind of thoughts. So in mindfulness meditation, we're not emptying our mind of thoughts, we're noticing thoughts. We're getting a little bit of distance from those thoughts so that we don't believe everything we think and we don't get sucked into everything that we think and feel like we have to react to it. So I should feel relaxed afterwards. This is also a myth. So with mindfulness, you may or may not, as you practice, always feel relaxed. So it's different than if you were to pay and get a massage, for example. If you were to go and get a massage, your intention is that you'll feel relaxed afterwards. Otherwise, why would you pay that money? But here, in mindfulness, we're turning towards our experiences, whatever they are, in the present moment. And sometimes they're not pleasant. But it turns out that over time, if we can begin to turn towards experiences, whether they're pleasant, unpleasant, or neutral, a byproduct does tend to be relaxation. So I'm too busy. We talked about I should feel relaxed. I'm too busy to practice. So taking the time to practice some of these tools I'm going to teach does take time out of your day. You're right. It can be as little as 5 minutes. It can be an hour. It can be just pausing and taking 3 breaths. But it does give you a return. It's an investment and it gives you a return on your investment. So even though you feel too busy to practice, if you're able to pause and practice, the research shows that you're more productive, you're more present, and you end up enjoying many of the tasks that you're doing to a greater degree. So while it does take time, you might notice even on busy days, you're able to have some balance and equanimity with some of these practices. So I'll be less productive if I'm focused, so I just addressed that one. So it actually turns out that people who do practice are more productive, even though you're taking this time out of your day. So why even practice? So this is a really growing area of research, and it's really interesting research. I'm going to spend some time talking a little bit about the benefits of mindfulness meditation and practicing. So it's been applied. The research is looking at all different kind of systems and holistically looking at what are the benefits of mindfulness meditation. But what we know to date is some of the most robust benefits are in the psychological realm. So we see decreases in anxiety and depression across clinical and non-clinical populations, and also in the realm of pain. So we see decreased pain severity, decreased disability, and increased pain acceptance. And these are the areas that have been where you find the most robust research. So it doesn't mean that these other areas mindfulness doesn't benefit, it's just that we're still kind of developing the research in this realm. Several years ago, a large group of us got together and screened about 19,000 studies, so any study that had any aspect of meditation in it. And we narrowed it down to the most robust clinical trials, so 47 trials that had active controls. And what we essentially found is what I just mentioned, that there's the most evidence for improved anxiety, depression, and pain across clinical and non-clinical populations. I wanted to take a few minutes and talk about the brain and how mindfulness can affect the brain. So this is a view of the brain and from a side perspective. And the parts in red, I have highlighted areas that are involved in mindfulness meditation. Let me see if I can make this. Okay. So we have the posterior cingulate cortex, which is involved in emotional regulation. And that's believed to be a large component of why mindfulness meditation works. We begin to be able to regulate our emotions. The insula is involved in self-awareness and perception. The frontal lobes are involved in executive functioning. And then this tiny structure, the amygdala, is involved in the fight or flight response. So this is the part of the brain that lights up even before we can fully process an event. This part of the brain lights up and gets us ready to fight or flee or freeze a situation. Now, we used to a lot of the research focused on long-term meditators when it came to the brain, and the brains of these individuals were scanned to see what is happening in the brains of people who meditate long-term versus the normal population. And what we saw was that there was greater activity in some parts of the brain and less in others. So greater activity in the frontal cortex, less activity in the amygdala, among other changes that I'll share with you in a moment. But what was really fascinating is that more recent research is showing that even after 8 weeks of practice, that we start seeing similar brain changes as those in the long-term meditation studies. Okay, and what are those changes? Well, we see increased activity in the prefrontal cortex and increased connectivity, as well as in the hippocampus, the part of the brain involved in memory formation, and even increased volume. So there's new neuronal growth in some studies in the hippocampus. We see those changes in the insula as well as the cingulate cortex. And importantly, we see decreased activity and earlier deactivation to emotional stimuli in the amygdala. And this is particularly relevant to the populations I work with who have anxiety and anxiety disorders, where you begin to see behaviorally that there's less anxiety. They're less easily triggered. And this is based on this research, at least this review, this is what's likely happening in the brain. But much of the research is based on this program, this mindfulness-based stress reduction course, which is an 8-week course where individuals meet for 2.5 hours each week and a full day silent retreat, and then home practice with guided meditations. And this is a very structured course, so this has been studied for many years because it's easy to study given the structure of it. It's based on this book called Full Catastrophe Living by Jon Kabat-Zinn. And the course basically includes, includes various sitting meditations, body scans, very gentle standing, lying down, chair yoga, mindful eating, mindful communication, walking meditation, as well as the silent retreat I mentioned. And so basically it teaches ways to formally practice mindfulness, but also how to bring mindfulness to daily life. So in terms of some of the research that I've been involved in, I mentioned that I run this group for patients and faculty and staff at Hopkins. And in the patient groups, we have a variety of patients come through. So they could have, primary anxiety, depression, but most of the time they have some co-occurring medical issues. I'm working with a postdoctoral fellow, Dr. Dorenzo, and she's now faculty. She's particularly interested in rheumatic diseases, and there's not a lot of research on mindfulness in rheumatic diseases. We did this review together, and there were just only a handful of studies. So what we're looking at with this population is not only the psychological outcomes. This is what this study showed, is that in basically consistent with previous research in clinical populations, that there were psychological benefits for the patients with rheumatic disease. But we're also interested in looking at the inflammatory markers and healthcare utilization. So the study we're looking at is kind of building on some of these concepts to see what happens to this population, specifically the rheumatic disease, in terms of inflammatory markers. I mentioned that I run this course for faculty and staff at Hopkins, and have looked at basically just some pilot data looking at burnout and stress, mindfulness, and work engagement. And there have been highly significant decreases in burnout and stress in the group I've looked at, and then increases in mindfulness and work engagement. This course is a time commitment. So 2.5 hours a week, a full day silent retreat, that's a lot to ask, but it's fascinating that these individuals make the time and they come through, and many people describe this course as life-changing. That's the experience I actually had with it myself when I took the course as a postdoc. It really shifts your perspective on your experiences. So while your external experiences may not be changing, you begin to relate to those experiences in a different way, with greater balance and equanimity. So I just put these quotes up because I really like this first one. Thanks for this incredibly difficult, simple technique. The idea is really simple. We're going to pause and we're going to be aware of the present moment. But you'll notice that putting it into practice is actually quite challenging, and that's why the course is so intensive. And if we are in fact changing our brains, then it's going to take some time to do so. I wanted to talk a little bit more about some of the research with various populations. This isn't my research, but just an overview of some of the individuals who you may come across and how mindfulness may impact their well-being. So and these are all systematic reviews, and basically looking at blood pressure, what this study showed is that both meditation and yoga decreased systolic and diastolic blood pressure, but that meditation was more effective for individuals who were greater than age 60, and yoga was more effective for individuals who were less than 60. So it's interesting. I think in the course, the way I describe yoga is that yoga can be a form of meditation. There is the physical activity, but it's really focusing on bringing your attention to the present moment with the postures, with the breathing. Mindfulness and smoking cessation. So again, this review looked at an active usual therapy compared to a mindfulness intervention. This is obesity. Sorry, we'll get to smoking cessation in a minute. And so basically what this study found was that there was weight loss. They incorporated mindful eating strategies, and there was weight loss across all of the studies that they looked at, and that 4 out of the 5 studies showed continued weight loss at follow-up with mindful eating. Mindful eating is a strategy where you really slow down and are using your food and the process of chewing and eating and swallowing as your anchor to the present moment. This is usually not how we eat. So, most of the time we are eating and checking our phones or on the computer typing, and that is not mindful eating. And what happens in those cases is our food disappears and we're wondering where it went, and we had inhaled it. And I'm speaking from personal experience. I'm not a mindful eater. This is how I eat. And we end up consuming more food than we would like, and we don't enjoy the process of eating. So I think this is one component of mindfulness that's important, is that there can be pleasure even in the mundane activities that we do if we can bring some attention to them. Even as you're sitting here eating, if you can bring attention to what you're eating and pause and slow down, you might notice that, hey, the food actually tastes better than I thought, or I don't need to eat this much. Or you might notice that the food doesn't taste good and you don't need to eat as much. So both of those things can happen. So mindfulness and smoking cessation, this study looked at, let me just catch up with you guys here. Okay, so increased abstinence rates to a greater extent than usual therapy at long-term follow-up. So in the mindfulness group, there was 25% abstinence at long-term follow-up as opposed to 13% in usual therapy. And one way that I sometimes explain the changes that occur to individuals is that when we practice mindfulness, we're decreasing the engagement of the primitive parts of the brain where we're confronted with a stimulus and we react, and we're engaging the frontal parts, the more evolved parts of the brain, so that we can pause and think about a situation, assess it, analyze it, kind of the parts of the brain that really make us smarter. And so that's one thing that mindfulness does. By engaging the frontal lobes, you can step back, you can assess a situation, you can analyze, you can pause, and you're not engaging those very basic, primitive limbic system parts of the brain that just, you have a stimulus and you react, stimulus and react. And then finally, in terms of the research, one of my colleagues did this study, which was really fascinating, with mindfulness and HIV in youth with this population ages 14 to 22. And so she looked at an active control group versus the mindfulness-based stress reduction group, and had some really interesting findings in that the mindfulness-based stress reduction group, they were more mindful. They engaged in more problem-solving coping strategies. They had reported increased life satisfaction and decreased aggression. And these things are really important. We work in Baltimore with the Baltimore population. They're so vulnerable. And so already having that vulnerability, and then on top of it, the HIV, these are very vulnerable youth. So it's amazing to have some of these shifts. But also what was really interesting was that the mindfulness-based stress reduction group had, at 3-month follow-up, they had decreased HIV viral loads, which is pretty remarkable. Now at this point, the speculation is that maybe they're just taking better care of themselves. They're being more adherent to their medications, but she's continuing to look at this, which is pretty amazing. There was, I don't know if you guys heard it, this was kind of national news, but there's an organization in Baltimore called the Holistic Life Foundation, and they have brought mindfulness into Baltimore City schools. And what they started doing is teaching the mindfulness meditation as opposed, when individuals misbehave, when the students misbehave, and the detention rates dropped to like 0%. So it's pretty amazing. So I'm a big fan of the mindfulness, but I think the science and the data is really compelling as well. So how can you begin to incorporate mindfulness into your daily life? And I start with ways that you can incorporate it into your daily life, because if you're not practicing these tools, you can't recommend it to a patient. These are tools that you need to practice to understand, kind of learn from the inside out. You can read about mindfulness till the cows come home, but until you embody it and practice it, you won't notice how challenging it can be. And some of the challenges for patients and individuals are that, kind of what I described early on, that when you pause, anything is fair game. You're confronted with distressing thoughts. Your pain may become more intense in the short term. And you have to know how to work with that. And which is why a teacher is helpful. But with kind of the small kind of tidbits that you can teach patients, or at least recommend to them, it's always nice for you to have practiced yourself, so you can say, yeah, I could see why this person doesn't want to do this. So, how to incorporate mindfulness into your day. At any point during the day, you can pause and take 3 breaths. Okay? You can do that right now. In fact, let's do it right now. So pause, and I want you to take 3 deep breaths. Take a deep breath in, and a long, slow exhalation. And then when you're ready, take another breath in, and a long, slow exhalation. And one more time. And if you really increase the length of that exhalation, that's when you're turning on that relaxation response. Now, if you have time for nothing else, you have time to take 3 breaths. I mean, you're breathing anyway. So here we're just slowing down the breath, bringing some attention to it. Okay? So that's kind of what the distinction is with mindfulness, that we're not necessarily changing our experience, but we are bringing attention to it. And that can make such a big difference. Okay? It's the difference between reacting and not being aware and thoughtfully responding with greater awareness. Okay? So if you don't have time for 3 breaths, sometimes I'm running around with patients, I think, I don't have time to take 3 breaths. Take 1 deep breath. These are ways that you can press the reset button on that stress response. Okay? So bring attention to your senses. Our senses always reside in the present moment. So if you can pause and bring attention to what you're touching, what you're tasting, what you're hearing, what you're seeing, then you're being mindful. You're bringing your attention back to this moment. Pausing before transitioning to a new task. So if you can stop and take a breath, or just pause for a moment before you leave this room, before you go from one patient's room to the next, before you get on email, then you're again stopping that stress response, that automatic pilot, and turning on a more mindful response. And please just pause before picking up your phone. This is such a big kind of autopilot for us, that we just pick up our phone, we get on email. Most of the time you're not getting a text that you won the lottery or some amazing experience. Often it's, oh my gosh, one more thing I have to do, or I forgot about this. So pause before picking up your phone. You may notice that you don't actually need to pick it up as often as you do. You know, do you really need to respond to that email right away? No, but we're conditioned to do so. And it turns out that it actually can be distressing to always be connected to so many different things all the time. So label your emotion. As psychologists, we have this phrase that if you can name it, you can tame it. So if you can put a label on what you're feeling, even if it's uncomfortable, sadness, anxiety, anger, whatever it is, that it actually starts to lessen the intensity of that emotion, if you can identify it. Again, we're stepping out of our experience and observing it a little bit, and then we don't have to get sucked into it as much. Catch yourself when you're on autopilot. So if you're driving home and you notice your mind is everywhere but on driving, and that moment you notice that's a moment of awareness. Okay. And then some sort of mindfulness reminder. Can you pause every time every time your phone dings, can you pause for a moment and take a breath? Something to remind you, because this is not our default to be mindful. One of my favorite tools, drop the story. So when we are confronted with a stressor, state the facts of the event. So I'm running late, for example. Notice your add-on thoughts that take you away from that. Oh my gosh, this is going to look so bad. I'm always late. What's going to happen? Is my supervisor going to get upset with me? This always happens to me. I hate everything. I hate everything in the world. That story that just keeps going and going and going and going. And you have an opportunity, if you can catch yourself in that story, to pause and just return back to the facts, to say to yourself, I'm running late. You can see how that is so much easier to digest than, I'm the worst person on the planet because I'm running late. You're just running late, okay? So this is one of my favorite tools. So a lot of people kind of don't know where to start if they are interested in learning a little bit more. Some of you may already meditate, but UCLA and UCSD both have a whole series of free guided meditations. These are nice meditations that you can use for yourself, but you can also recommend these to patients if you think that they're struggling with stress and anxiety, depression, whatever it may be. These are some popular apps. The Calm app is really popular. Headspace they're both popular. They all have free components, and then you can pay an annual fee if you'd like to have access to everything. The Calm app has a sleep section, which many people like, where some people with really soothing voices read sleep studies. It's not sleep studies, sleep stories to you. So basically, you're traveling through the hills of France and the lavender fields and kind of adult sleep stories, appropriate adult sleep stories. But there's also here, you'll see in these guided meditations, there's something called the body scan, and that's also an excellent tool to use before bedtime. So when to practice mindfulness? Many people like to do it in the morning, but you have to make it kind of fit your schedule. So if you're not a morning person, you're not going to wake up 15 minutes early and do the meditation. You may do it at lunchtime. You may do it in the evening. You do need to be awake to derive some of the benefits of the mindfulness, unfortunately. So that's one thing to keep in mind. It's often nice if you have some sort of exercise routine to do the mindfulness right afterwards. The mind tends to be a little bit more settled after physical activity. But the body scan is a good one to do if you have difficulty sleeping. And you can also just Google these on YouTube or whatever, and you'll see hundreds will come up. So yeah, some people also ask, where can I take the mindfulness-based stress reduction course? That's a little trickier, so that's something that I teach at Hopkins, and I may be I may be at this point, maybe even the only person at Baltimore who's currently teaching it. It's very hard to find kind of certified teachers, but DC and there's Insight Meditation Community of Washington, and they have kind of in the DC area and Silver Spring, they have mindfulness-based stress reduction courses that they run. So that's an option that might be closer for many of you. There's also an online version through the University of Massachusetts Center for Mindfulness. You do have to pay for these courses. The benefit of the ones I teach for patients at Hopkins, the benefit is that I accept insurance for those courses, so that's nice. So if we participate with their insurance, then the insurance will pay for the course for patients, especially for the patients who can't afford to take the course otherwise. That's really nice. So I'm hoping that we can fit in a practice, but let's see. So why don't we do a 5-minute practice, and then the rest of the time I'll leave for any questions, okay? So if you'd like to engage in this practice, you can just kind of find a comfortable position for yourself to begin. If you don't want to participate, be mindless. What do I care? Be mindless and stressed out. Okay, so find a comfortable position for yourself, maybe having your feet flat on the ground. your hands in your lap. If you'd like, you can close your eyes. Otherwise, just kind of having a soft gaze in front of you. And begin by just taking a couple of deep breaths. With each out breath, allowing yourself to let go of where you were a moment ago and where you might need to be later. And bring your attention right here. Beginning by noticing sounds. And you don't need to label the sounds, but just identify them, just note them. So swishing of the air conditioning or tapping, whatever you hear, you don't need to attach a story to the sounds. And now shift your attention to any smell that's present, and notice that. Notice sensations in your hands, temperatures and textures. And sense your feet coming into contact with the floor. And then bring your attention back to your breath. Noticing this in-breath. Noticing this out-breath. And your mind will wander. You're not doing anything wrong if your mind wanders. Each and every time your mind wanders and you notice that, it's a moment of mindfulness. You can just begin again on the next breath. Breathing in, noticing that you're breathing in, and breathing out, noticing that you're breathing out. And with the next breath cycle, see if you can be present with the breath from the beginning of the in-breath through the middle to the end of the out-breath. And when you're ready, you can open your eyes, maybe take a moment to stretch out. So if you've never meditated before, congratulations, you just did. So it's not this mystical experience that people think it is. It's just kind of bringing your attention to what's happening right now. So I think we have a little bit of time for questions. Yeah.
What was the title of the book?
The book is called Full Catastrophe Living. Full Catastrophe Living. Mm-hmm. Yeah.
Is there any research with mindfulness and, say, dementia or?
I think there's a little bit, and I'm not familiar with it. I should actually look into that more. Let me think if anything comes to mind. You know, in terms of, I don't know exactly what kind of any randomized controlled trials with the dementia, but in terms of memory in general, you do notice an improvement in memory sometimes with the mindfulness. And the reason, you know, one way to think about it is that we're actually attending to stimuli. So for example, if you're really mindful when you walk in the door, you notice that you put your keys someplace as opposed to just putting them someplace and being mindless. And so you do see people reporting an improvement in memory in general. Now, whether there are any protective benefits or whether it affects kind of the population who's already been diagnosed with dementia, I'll have to look into that. Good question. Yes?
What level of anxiety
Uh-huh.
do you inject this mindfulness practices? If you're, I don't know, panic level
Yeah.
versus moderate level, where does this have the greatest efficacy?
Yeah. So the question was, where is the greatest efficacy in terms of the level of anxiety? I think that, I think part of it depends on the training. So if an individual has never had any mindfulness and they're having a panic attack, and I say to them, okay, let's pause, let's notice the symptoms, notice how shallow your breathing is, they're going to have trouble with that. And so it's not always wise to implement the mindfulness. I think that for someone who's just starting out, kind of having lower to moderate levels of anxiety can be more helpful, or at least not having them in the midst of some sort of panic. But people with pretty severe anxiety disorders come through the courses and do quite well. It's just that you have a gradual building of the skills. Yeah. Mm-hmm. Yes.
Is there any evidence around doing mindfulness practices in a group versus individually?
I can speak anecdotally to that question in that some people can pick it up individually. They can use an app and they're very kind of motivated, and I think it depends on the type of person. I think there's something really powerful about being in a group setting, and part of that is normalizing that, hey, I'm not the only one whose mind is all over the place, or with the faculty and staff in the case where I teach, that hey, I'm not the only one who's feeling isolated and burnt out. But I think there's also an element of accountability that you show up for the class, you do the home practices because other people are, and it's really hard. If you're really busy and you have all these things to do and you've added mindfulness to it, mindfulness is going to be the first thing to go off the list usually for people. And so I think doing it in a group setting, whether you take a course or get a group of people together and listen to an app together, I noticed can help with the motivation and the accountability of it. Yeah. Yes.
How would you what's the process of getting hooked up to enter the class as a patient?
As a patient, so the best way at this point is, I can give you my card if you wanted, is to either email me or call my clinic, and then I will reach out to the patient. They need a one-time evaluation with me just so that I know what's going on with them, and our staff checks on the insurance to make sure that we participate with it. And then as long as the patient and I agree that they would be an appropriate fit, they can join the group. Mm-hmm. So if you want my card, you can just hang out for a moment and I'll give it to you at the end. Okay. Well, thank you. Mm-hmm.